Anthony Albanese was out spruiking another government handout to Rio Tinto today, but I think they've got a big problem in aged care. 3,000 elderly and disabled Australians stuck in public hospitals. I think that's a national disgrace. They'll be at home they can't get into homes or residential care. I've got a mother in her early 90s. I'm going to have to confront this at some point not far away. They talk about a looming crisis. The crisis is here right now.
Yeah, not just here right now, but has been here for years. Again, I remember in 20 years ago or more when I was in the state press gallery in New South Wales Parliament, and the state government here was blaming the fact that it had so many hospital beds backed up with people who should be in aged care. It just goes on and on and on. It's a real structural problem in aged care. You've got it's hugely expensive. It's very difficult and this is going to sound callous, but it's very difficult for companies to make a buck out of it, which means that there's no incentive for businesses to go into that sector. Governments often need to prop it up, or they have to basically tell people that to go into them, they're going to have to remortgage their family home. And also, of course, and again, this is where things get more and more complex, but there's a worker shortage. There's a massive shortage of aged care workers, which is why we need to bring people in from overseas. And then that can raise issues sometimes with language barriers as well, and people getting the care that they need when often the client, your mum or dad, your grandma or granddad, might not be the best communicator in their condition in the first place. And then you've got that additional language barrier. You've got to make sure, of course, the qualifications match up. But again, that's one reason why we need this skilled migration program. But then, of course, that then causes its own flow-on effects in terms of housing. So it is basically a big hot mess, but it is something we do need to do, because hospital beds, to paraphrase Anastasia Palaszczuk's infamous comment during COVID, hospital beds should be for hospital patients, not for people who should be somewhere else.
Mia, we had a Royal Commission was supposed to sort this all out.
Well, yeah, and nothing's been sorted out, because I know Labor can't spend their way out of this one because, quite frankly, they've run out of money. I mean, they're throwing billions and billions of dollars at this. We've got state departments, we've got federal departments, we have an ever-growing NDIS, yet despite all of the money being thrown at this, there seems to be no solution. The fact that we have 3,000 Australians not receiving the care they need is absolutely appalling, and it's time to start looking at where all this money is going. But of course, anytime we start opening conversations about what we're doing with the NDIS and all the reckless spending that's been spent there, people shut it down. But we've got to start talking about these things because we need better outcomes.
Joe, I think I'm watching an episode of Utopia when it comes to this tobacco trade.
Yeah, it's mad.
We decided we'd make legal cigarettes so expensive that the bikie gangs and organised crime could import them all from China and make millions. I mean, surely we have to sort that mess out.
Yeah, I'm very fond of quoting the Roman Emperor Tiberius in this one, Prices. I'm sure you are as well, which is that a good shepherd shears his sheep, he doesn't skin them. And this is what the government has done. It's gone from having a nice sort of tidy little earner with a tobacco excise that actually brought in more money than cigarette smokers cost the economy. So one of the original rationales for bringing in the tobacco excise was not just to make cigarettes more prohibitively expensive and hopefully encourage people to quit, but to say, right, well, smokers are costing the economy, billions of dollars a year in terms of, or the government, sorry, the taxpayer, in terms of increased healthcare costs and also economic costs, because they're sick more often, they're not as productive. So we need to recoup that. That tipping point has actually gone over the top.
We need to go back to the point. Well, Joe, we have to have a debate about whether we knock off some of the excise.
Yeah, absolutely. This is the thing.
Joe, have a great weekend, both of you.
Mate.
Enjoy yourselves.